best to deliver that as much as possible. So these are some of the things that they hear at Aerolase every day. What can I safely use on skin of color? I need something comfortable without downtime. And why do I need 5 devices when I can only have 1? Traditional lasers have been painful. Most of the time, that's what they are. They're not always inclusive. We know this because we see these stories every day on TikTok of these uncredentialed folks messing people up. They can be high maintenance, and we all know the fastest way to get rid of a laser up, all laser ups except Udelki, is to buy. So the mission, healthy energy for all skin. They didn't just retrofit an older device. This was specifically designed for populations that come into our offices to be able to thrive and have successful treatments in a safe manner. So, you know, we want to do that with as few devices as possible. I don't know about y'all, but ever since that, did y'all ever see that slide that was distributed widely from that laser? Yes. Yeah, where they like totally were playing us like fools.
Can you fix it?
Sorry?
Can you expound on that?
Yeah, so there was a slide that was leaked from a laser, like, you saw that, yeah. So this is the first laser that I've experienced that can kind of address all of these concerns for patients under one device, and does it in a very inclusive, versatile way that allows you to have one device that you can keep for a very long time with no consumables. And so introducing a new standard for skin wellness, get it? That's my practice name. Anyway, introducing the NeoDerm. So the NeoDerm is specific. Is this still true, Udelki, where NeoDerm is only sold to dermatologists?
Only dermatologists.
So that's another distinguishing feature that most of these other companies can't lay claim to. When we're delivering these treatments, we're giving them something that they can't get at the med spa, they can't get at the OBGYN office. No shade if any of y'all snuck in. But and why it's different, it is an Nd:YAG laser, but it's a different delivery with the 650 microsecond pulse duration, which allows it to be a lot safer and keeps that heat to a level that is tolerated well on 100% safer skin of color without the risks of the traditional lasers. It is FDA cleared for many different indications, including acne, melasma, rosacea, PIH, rejuvenation, and more. And if you talk to Udelki, she can give you some tips on how certain insurance carriers in your area may even cover some of these treatments for patients. It's lightweight, it's easy to port, it's not, again, no consumables. What I like about it is that when I'm describing how we're going to use it to patients, I can really build in more than one thing. So it can do laser hair removal, and it can do the pigment that goes along with it. It can treat the active acne and the hyperpigmentation and improve the skin quality all at the same time. So one powerhouse, again, and a unique technology addressing acne, melasma, rosacea. Who has the device in the audience? All right, so, you know, sorry, Mina, you had something?
I was waving to you, Doctor.
Okay, all right, sorry, I thought you. So why do we love it? No numbing, no cooling, no contact. It's truly a lunchtime procedure. We can use it safely on all skin types. It is compact. It is 100% profit per treatment. You're not spending a bunch of money on, you know, some cartridge or something that has to be changed out every time. And it's quick. I delegate this this treatment to my laser techs and estheticians, and they do a phenomenal job with it. So this is just a chart to show how it outperforms traditional lasers. Again, painless, no cooling. 650 microseconds is really the distinguishing pulse duration that sets it apart from the rest. The treatments are only 10 to 15 minutes, safe for all skin types. You can do other things in one. So right here we're highlighting the fact that you can use it with the Aerolase Era, which is their ablative device. But we also, and I can say this, right? We use it in combination. There's a protocol where you can do NeoDerm treatments and then apply a VIPO right behind it, and you get really phenomenal results, and patients are very happy, and they only have to experience that, you know, downtime period one time. 36 different indications, again, low cost. as opposed to the rivals, which have limited applications, the skin is overstressed, and then you are going to have to use some kind of consumable and those really expensive numbing agents, which they do work well, but they're very expensive. So which is, make sure that your MAs understand that you don't need a lot of that stuff. This is off topic. But I get so mad when I go in there and I have to wipe off the numbing. What do you mean wipe it off? You shouldn't put so much that you have to wipe it off. And then they wipe it off and throw it right in the trash. And that it's very clear that they're not the ones paying the bills for that stuff. All right, so here's the results. That's what we want. We want to see the results. Show me the results. This is a patient with rosacea. Good improvement there. This is phenomenal. Just active acne here, nodulocystic scarring with post-inflammatory erythema and on Accutane, says Udelki, right? Another patient here with rosacea, improvement in skin quality. This is maybe my favorite indication, pseudofolliculitis. You're going to get rid of the hair, you're going to help the pigmentation, and you're also going to help their skin texture. And this, I promise you, this is the happiest woman up here because they search and search and search. You just have to make sure that they understand they get it before it turns white or gray, because that's when they're stuck with it. Another pseudofolliculitis patient, and then skin texture acne patient there too. So designed for skin of color. And they are committed to dermatologists who treat patients with skin of color. They have all sorts of adjunct programs. Once you are in the Aerolase family, clinical trials programs, they will help. There's a referral program. So anybody who buys today, Rejoki, that's on me. And just a lot of different things that you can treat. Medical treatments like acne, rosacea, psoriasis, melasma scars. And then on the aesthetic side, skin rejuvenation, pigment texture, scar reduction, hair removal, wrinkle reduction. And you just help patients feel a lot better about themselves on a regimen that we have been able to offer at a very affordable price as well when you compare it to the other treatments, because you don't have those consumables. It is just a short amount of your time, and you can easily delegate it to people in your office so that you can do other things. These are some of our esteemed colleagues who are also partners with Aerolase. Dr. Michelle Henry in New York City. Andrew Alexis says he trusts it because it balances efficacy and safety, making it the best choice. He's also in New York City. And then our own Dr. Kindred, who may be in the room, maybe not. Hey, where's she at? She's not here. Okay. But we need safe, effective treatments, and Aerolase provides that to patients and makes us, and Kim, makes us sleep a little bit better at night. She mentioned that in her talk. So again, their commitment to us has been phenomenal, and we appreciate that. And we really like it when you invest in dermatologists, particularly dermatologists who are often burdened with treating patients that other people either don't feel comfortable treating or are not equipped to treat. And then we're going to do a demo. So if you're in the front, one of these front tables, there are goggles that you will need to put on when we do the demo, and that you are to leave on the table. Udelki will chase you down if you try to walk out of here with her goggles, okay? So if you see a little plume, that's vellus hairs that are being treated inadvertently. So that's a bonus. Good. So wand technique, you want to keep it as perpendicular as possible. This is rounding out our last pass, and then we're going to move on. You okay? Okay, turn to your left. Good. And we'll get this cheek area. Here we go. So I think, you don't have to use any topical numbing here. Of course, it's going to be a less expensive procedure to your practice if you don't. Sometimes patients are a little more sensitive and you want to offer that option. And sometimes, let's be honest, it's nice to have the time so you can catch up.
Corey, are you overlapping or are you shooting straight?
I'm not really overlapping. Yeah, we're sort of keeping it moving in a wand-like area. We're going to go in multiple directions to make sure that we don't have any skip gap areas with our 3 passes. Good. Perfect. We have one more pass here. We'll make sure we get the neck.